Hi, my name is Dr. Michael Savko. We're going to be treating Oscar today. Oscar came into the clinic. He was paralyzed, and now he's actually able to walk, take a few steps. We've been doing some neurological work with him and some muscular work with him. So the whole first phase of this, basically, we're right on the spine, hitting specific neurological points. And what we're trying to do is we're trying to get the nervous system to work better. When I pull this trigger, nothing is supposed to happen at all whatsoever, so you might see little reflexes in the animal, and when that happens, that means that there's neurologic static in those areas. So the first time I pull the trigger is diagnostic. Every other time I pull the trigger on an area is therapeutic. So right in that area there, when you see his legs bouncing, when I pull this trigger, nothing happens. See, just from the noise, he's not bouncing at all whatsoever. So basically, as I come down, and when any areas we get the bouncing, what that means is that the nervous system is not working appropriately in those areas. When we first started treating Oscar, when he could not walk, these reactions were much, much greater, which meant that he had much more neurologic problems. Now he's starting to function a little bit better, and he's starting to get things moving a little bit more, so the reactions that we're getting aren't as great.
Yeah, we're early, but I never know how long it's going to take me.
Not a problem. They're just recording the video here on the screen.
It's perfect. Thank you. Yeah, I'm coming all the way from over by Swiftly.
So there's another reaction right there in the middle of his neck. See, when I pull this trigger, his head doesn't bob, his eyes don't blink. Right there's a reaction. Okay, the whole second phase of this, instead of me being right on the bones and right on the bony landmarks, is muscle work. So the first part of it, we release the nerve. Your nerves are responsible for pain and function. So we release them and remove the static to allow the nerve to work better. And then we come through and we relax the muscles and balance the muscles. So you can really see him bouncing a little more with this. So neurologically speaking, what that means is he's much less pinched, there's much less static, but we're still dealing with a good amount of muscle spasm. As you see how his whole body bounces when I pull the trigger and hit certain areas. So as you can see, his whole rear end will bounce around, and if you watch his leg, this whole leg will bounce around. So what that indicates is that there is muscular spasm in this area, and these are the areas in the nerves that control the legs. So the goal is to find and reduce neuromuscular imbalance, therefore reducing pain and restoring function. And he is done.
Good boy.